Have you ever tripped on a rug in your living room? Or maybe you've lost your balance going down a single stair. For many of us, those moments are just a quick scare. A few that was close. But for millions of people over 65, that close call is a daily silent terror. It's the fear of a fall that could change everything in an instant. A simple fall isn't just a bruise. It can be the start of a cascade of health problems, broken bones, head injuries, and a devastating loss of independence. In fact, a fall is the leading cause of injury and death among older adults. Yet, believe it or not, this isn't an inevitable part of aging. The secret isn't luck. It's knowledge. It's knowing what to do in those first 10 seconds. It's understanding that you have the power to protect yourself, and that power starts now. A doctor's promise. I'm Dr. Evelyn Chun, a physical therapist with over 4 decades of experience helping thousands of people regain their strength and mobility. Throughout this time, I've seen firsthand the physical and emotional devastation a fall can cause. I've also seen the incredible resilience of those who are prepared. Today, I want to speak with you with complete honesty, as if you were sitting right here in my clinic. What you're about to hear could be the difference between a lifetime of health and a permanent loss of independence. Because when you suffer a fall, your chances of a major injury reach 75%. However, if you understand what to do in those first few seconds, those odds change dramatically. You could have an over 90% chance of a full recovery. Do you know what makes the difference? Knowledge versus ignorance. Lack of information can be deadly. That's why today, I'm going to share everything I've learned during more than 40 years in medicine. A few months ago, I received a call at 3 a.m. A woman was crying on the other end of the phone. Dr. Chun, it's a miracle. My father is fine. Thank you for teaching him what to do. She was referring to Mr. William Harris, an 85-year-old patient of mine. He had tripped on a loose tile at home, completely alone and without anyone's help. He managed to follow the steps I had taught him months earlier, and not only avoided a serious injury, but also got himself back up safely. When I reunited with him, he told me something I can't forget. If I hadn't remembered what you explained to me, doctor, I would be lying there for hours. What saved his life wasn't luck. It was preparation. It was having listened, having practiced, having been ready. Today, I want to give you that same opportunity. If you found this information valuable so far, please hit that subscribe button and the notification bell. This knowledge could save your life or someone you love. The science of stability and prevention. I'm going to share with you the 8 key steps to survive a fall when you're alone. And I'll do it in clear, direct, and human language. Because this knowledge isn't taught in medical schools. It's learned through experience in the corridors of hospitals, in the stories of those who have been on the edge of death and returned. But before teaching you those 8 steps, I need you to understand something very important. A fall never arrives like in the movies. It's not a dramatic slip with a huge scream and a theatrical collapse. The reality is much more silent, much more confusing, and much more dangerous. The day Mr. Harris fell, everything seemed normal. He had gotten up at 6 a.m. as always, prepared his coffee, and was walking to the living room to read the newspaper. But suddenly he felt something strange under his foot. It wasn't a sharp pain. It was a subtle unsteadiness, a slight loss of balance. He thought maybe he was just tired, that it would pass. But 10-20 minutes passed and the feeling didn't go away. On the contrary, it got worse. He started feeling a dull ache in his knees and a numbness in his feet. In that instant he knew. This is a sign of instability, he thought. And that awareness made all the difference. If he had told himself, surely it's just my age, it'll pass, he probably wouldn't be able to tell his story today. Statistics don't lie. 87% of people who experience a near-fall event dismiss the symptoms as something else. They think it's just a digestive problem, a stiff joint, or muscle pain. And while they waste valuable time, their balance and muscle strength are being damaged with every minute that passes without attention. Now listen carefully to this. People over 65 who live alone have 4 times higher risk of dying from a fall-related injury than those who are accompanied. And not because they have a weaker body, but because when alone they often don't know what to do or do nothing at all. But that doesn't have to happen to you. Because even if you're alone, you can prepare, you can learn what to do, and you can act at the right moment. Mr. Harris didn't save himself by luck. He saved himself because months before, He had attended a talk where I explained exactly what to do if he felt unsteady or suffered a fall. And when the moment came, he remembered every step. Instead of panicking, he looked at his surroundings, took a deep breath and said, "Very well. Now I must start the step-by-step process." That's the difference between someone who is prepared and someone who isn't. Those who are prepared maintain calm even in the worst moment because they know what to do, how to do it, and in what order. Those who aren't prepared become paralyzed, desperate, and often make decisions that worsen the situation. And if you also have risk factors like arthritis, vision problems, or have had a previous fall, the risk is even greater. But the most important thing is this: even if you have all those factors against you, if you're prepared, you can survive, and not just survive, you can do it with the least possible damage. Mr. Harris is completely recovered today. He walks again, goes for groceries, enjoys his grandchildren, and all thanks to preparing in advance. You can do it too. In the next part, I'm going to teach you what are the 5 most important signals your body gives you before a fall, and how to recognize them before it's too late. Falls, in the vast majority of cases, don't arrive suddenly. Your body warns you. I want you to remember these signals well. Write them down and share them, because if you ever feel them or see them in someone you love, you'll be able to act in time. 5 warning signals of an impending fall. A sensation of dizziness or lightheadedness. It's not a headache or a sharp pain. It's a feeling like the room is spinning or that you're about to faint. Some patients tell me, "Doctor, it was like a sudden wave of nausea washed over me, and my head felt empty." And this feeling doesn't last a few seconds and go away. It usually persists for more than 15 minutes and doesn't improve with rest. Radiating numbness or tingling. It begins in your back but then extends to your legs or arms. In women, this is especially common in the lower back and can be mistaken for a muscle cramp. I know patients who thought it was a simple stiff back, and instead of consulting a doctor, they just tried to stretch. Extreme fatigue without apparent reason. If one day you feel exhausted without having made any effort, as if your body couldn't go on anymore, that could be a signal that your muscle and nerve signals are not functioning correctly. This signal is very common in men and usually goes unnoticed. But if it occurs along with other signals, you must act immediately. Sudden difficulty with balance and coordination. You're at rest, haven't climbed stairs, and suddenly you find yourself feeling unsteady. You start shuffling your feet or have to hold on to furniture to walk. It's one of the most alarming signals and is often confused with an anxiety attack. But if it occurs along with dizziness or limb numbness, it's a clear signal that your body's balance system is in distress. Weakness or pain in your knees and ankles. If you suddenly feel that your knees are giving out or your ankles are weak without explanation, don't attribute it only to old age. Many people take a painkiller thinking it's just a temporary ache, when in reality they're already in the first stages of a balance decline. And here comes something very important. You don't need to have all 5 signals at once. Having 2 or 3 is enough to suspect a fall risk. And if you also have risk factors like osteoporosis, poor vision, or you take multiple medications, just one of these signals is enough for you to act immediately. Mr. Harris, the patient I told you about before, recognized 3 of these signals: subtle unsteadiness, leg weakness, and sudden fatigue. And that was enough for him to understand what was happening and act without wasting time. Thanks to that, the damage to his body was minimal. Today, he still walks every morning and enjoys his grandchildren. And I want you to reach that point too. So, now we're going to move to the most important part of this video, the 8 steps you must follow if you're alone and begin to feel that you might be suffering a fall. You don't need to be a doctor. You don't need specialized equipment. You just need memory, calm, and decision. Because even if you're alone, even if you live far from a hospital, these steps can increase your chances of surviving up to 90%. So pay attention, listen calmly, and above all, practice it, because as you'll see, most of these steps can and should be rehearsed before an emergency arrives. We prepare for many things in life, but very few prepare to survive a fall. And that's going to change today. Are you ready? Let's go with step number 1. 8 steps to take when a fall happens. As soon as you start feeling symptoms, stop everything you're doing and sit in a safe place. Don't keep walking. Don't think it'll pass. Don't tell yourself, "I'll wait a few more minutes." Just stop. Look for a chair or sofa with back support and sit with your back supported. Don't lie on the floor. Lying on the floor makes it difficult to get up and can worsen your condition. Don't stay standing either. The priority is maintaining stability and avoiding falls. Mr. Harris was about to go to the kitchen, but as soon as he felt unsteady, he sat on the nearest chair with his back supported. And thanks to that, he didn't collapse or lose consciousness. That first step, although it seems simple, saves lives. Take a deep breath and assess your body. If you do fall, take a moment to breathe and check for injuries. Don't panic. Do you feel pain anywhere? Can you move your arms and legs? If you feel severe pain in your head, back, or neck, do not move. If you are injured, continue with step 3. Call for help immediately. Have an emergency number saved in your phone, or use a medical alert device. The most important thing is giving your address clearly and completely when starting the call, because during a fall you can lose consciousness at any moment. And if you didn't give the address before, medical services won't know where to find you. If you are not injured, crawl to the nearest piece of furniture. Don't try to stand up from the floor. That can lead to another fall. Instead, crawl to a sturdy chair or a couch. Use your arms and legs to slowly get there. Adopt an inclined position of 45 degrees with legs slightly elevated. Once you reach the furniture, recline your body backward at a 45 degrees angle, leaning on a chair or sofa. And if you can elevate your legs slightly on a cushion or pillow. Why this position? Because this way you help blood continue flowing to the brain and heart without overloading the lungs or circulatory system. If you lie down completely, fluid can accumulate in the lungs. And if you sit too upright, the heart works harder. Send a brief text message to your family members. Don't make phone calls. At this moment, you shouldn't talk on the phone. Talking involves effort, and that effort can worsen your condition. Instead, send a brief direct text message without unnecessary details. Something like, "I have fallen at home. Called emergency. They are taking me to the hospital. Don't worry, come there." And don't send it to just one person. Send it to 2, 3, or more family members. This way you ensure someone sees it even if another doesn't respond. Breathe deeply. Inhale for 4 seconds and exhale for 6. This type of slow, controlled breathing reduces the heart's workload and helps maintain calm and oxygen flow. It's important that breathing be abdominal, not just with the chest. And if you can, make a soft sound when exhaling to make it more controlled. This technique not only relaxes, but also improves circulation and helps you gain time. Press the inside of your wrist and cough 3 times hard. This step is little known, but can help you in a critical moment. With your thumb, press firmly on the inside of your wrist, right where you feel your pulse. At the same time, cough hard 3 times in a row. Why does it work? Because coughing generates pressure inside the chest that stimulates blood flow, and pressing the pulse regulates heart rhythm. It's not a replacement for medical attention, but it's a tool to keep you stable for a few more minutes. And those minutes can make the difference between living or not. Mr. Harris applied these 8 steps with total precision. He didn't improvise, didn't hesitate. He acted like someone who had prepared. 14 minutes after calling emergency, the ambulance arrived. They found him conscious, calm, and in correct position. Today, months later, his body functions normally, and his story has already saved other people who watched this same video. Now it's your turn. Learn these steps. Write them down. Stick them on the fridge if necessary. The practical meaning. The 3 golden habits. Until now, I've explained how to act if you're alone and feel you're about to fall. But there's something even more important. Preparing before it happens. Because no matter how much you know what to do, the ideal is that you never have to use it. And that's possible. Throughout my career, I've known hundreds of people over 80 who have never suffered a serious fall. Do you know what they had in common? 3 simple habits that anyone can adopt and that reduce fall risk by more than 70%. I call them the 3 golden habits. Golden habit number 1. Walk 30 minutes every day. You don't need to run or do intense exercise. Just walk 30 minutes every day. What matters isn't speed but consistency. Let me tell you about Mr. George Thompson, an 82-year-old man who lives in New York. For more than 25 years, he gets up at 6 a.m. and walks in the park. It doesn't matter if it's cold or hot. My body asks for it, he tells me. His last checkup showed his balance functions like someone who's 60, and his only secret is that walking every day. Golden habit number 2. Keep your home safe. A cluttered home is a dangerous home. And the problem is that most of us don't even realize how many small hazards we live with. Avoid throw rugs, loose electrical cords, and uneven flooring. Instead, install grab bars in the bathroom and use non-slip mats. Mrs. Rosario, 79 years old, confessed to me that at first it was difficult. I felt my house was empty, she said. But after a month, she felt more secure than ever. Now I can walk around my home with confidence, she says. Golden habit number 3. Quit sedentary habits and get regular checkups. I've heard the same phrase many times. Doctor, I'm already 70 years old. Why start exercising now? And I always respond the same. Because you're still in time to improve your health. Mr. Carlos, 74 years old, started doing light exercises at 70 after 50 years of a sedentary lifestyle. I thought it was useless, but in 6 months I felt stronger, more balanced, and even went back to climbing stairs without getting tired. It's never too late. Never. Your body always appreciates change. And please get your eyes and ears checked at least once a year. An eye exam and a hearing test can detect problems before it's too late. Now I want to do a review with you. Let's engrave it in your mind and heart. 5 warning signals of a fall. Pressure or weight in chest center. Pain radiating to arm, neck, or jaw. Fatigue without apparent cause. Difficulty breathing and cold sweat. Dizziness, nausea, or vomiting. 8 steps to act if you're alone. First, sit in a safe place. Second, chew an aspirin. Third, call emergency and give your address. Fourth, open door and leave key or code visible. Fifth, recline at 45 degrees angle with legs slightly elevated. Sixth, send brief message to family. Seventh, breathe 4 seconds inhaling. 6, exhaling. Eighth, press your wrist and cough 3 times. 3 golden habits to prevent falls. Number 1, walk 30 minutes every day. Number 2, reduce salt consumption. Number 3, quit cigarettes and alcohol. But there's something more I want to ask you. Write these steps down. Stick them on your fridge beside your bed or where you see them every day. And if you can, rehearse them. Act as if you were having a fall. Look at the clock. Sit down, breathe, act. It's not exaggerated. It's preparation. It's prevention. It's love for your own life. And now I want you to do something more. Go to the refrigerator, take a sheet, and write the following. I am prepared. If a fall comes, I'm not going to give up. I know what to do, and I'm going to stay safe. Read it every day. Make that phrase your promise to yourself, because you're not alone and because you deserve to live many more years with health, joy, and peace. I'm Dr. Evelyn Chen, and after 40 years accompanying thousands of people, I assure you this: you can defeat the fear of falling. And today you've taken the first step. If this video helped you, please hit that subscribe button and ring the notification bell so you never miss life-saving content like this. Share it, send it to your parents, siblings, or friends, and leave me a comment writing, I am prepared. That's not just a comment. It's a promise to yourself and a declaration of life. Take care of yourself, and I sincerely wish that your balance and strength stay with you for many, many more years.